Scripps Translational Science is the only academic research organization that we know of in the world that focuses purely on the clinical trials of mobile health technologies. The evidence base of mobile health, I think, is really important. And so when you come to any meetings, sometimes meetings like this, you'll see a lot of perfect solutions for multiple different things in apps and other devices. I would argue that if you went to an alternative medicine conference, you would have a similar talk about how this vitamin or this supplement or this does this for this and cures cancer and prevents heart attacks. And it's not evidence-based, and it's a lot. And I'm not saying mobile health is in that way, but we have to be careful that it doesn't go in that direction. And even a lot of mainstream medical technology that's used now is not evidence-based. Robotic surgery is a great example of that. There's financial incentives to do robotic surgery, so that's what drives that. But with the mobile apps, there are a lot of really good ideas, but there still needs to be the evidence showing that if we incorporate this, that it does improve blood pressure control, it does decrease patients' hemoglobin A1C for diabetes, but that it does it in a way that doesn't add extra stress to their life, that it actually adds to an improved quality of life for them. And I'm sure those solutions are out there, but we have to be able to demonstrate that if we really want to drive the clinical uptake of these technologies. Other people have described mobile health as right now death by pilot. And others have said there are more pilots than in the U.S. Air Force in mobile health. And pilot studies just mean they're nice, small 10, 20 studies that are meant to be first steps. But they end up being the final step because they'll find solutions that look really positive. But pilot studies in general are designed, are typically not rigorously designed. They don't give you strong enough results to change practice. And in reality, we only hear about the positive pilots. The small pilots we never hear about. And so as a field, we really need to move well beyond that. And we can. And more tools are enabling us to, in fact, for the first time, be able to do 5,000, 10,000, 20,000 person trials quickly and inexpensively. It's going to take a little bit to get that infrastructure in place, but it's coming. Clinical trials can sometimes be looked at as very clunky and this extra burden that only egg-headed academics are interested in. And really, it's what they need to be looked at is it can be part of the implementation of a new technology, but it has to be a thoughtful implementation so that if you say, okay, we think that we've got the world's greatest gadget for helping people manage their heart failure. Well, you implement that in a clinic or in ideally 2 or 3 clinic settings, and you actually track meaningful endpoints and ideally having a comparator group that gets standard of care where you show that by implementing this, you improve patient outcomes, you increase their convenience, that they didn't feel like suddenly that they were crippled by the fact that they're wearing a monitor that's telling them all the time what's good and bad. And you have to be able to show all that, but you can do that as you're clinically implementing it and showing the world how well it works. And that's the kind of data that's going to make another healthcare system or other healthcare providers take notice and say, wow, when they did that, they decreased hospital admissions by 30%, patient happiness was improved by 50%. We can do the same thing, and now we're going to do that.